multitude of voices,
at single velocity,
delivering news at the speed of sound.
107.9 in your radio dial.
This is the program that everyone has been waiting for.
DYZX Real Talk Radio 91.5 on your dial.
DYZX Real Talk Radio.
A member of KBP.
Kapisanan ng mga broadcasters sa Pilipinas.
Good afternoon, bye-bye.
Good afternoon, Philippines.
Today is Thursday, May 27, 2021. I am Devine Oclarit.
And I'm Camille Marapoc.
Bringing you the hottest and sizzling issues of today.
For the headlines,
117 Colorado nursing homes received fines from the federal government.
Wearing a face mask in England, a must after Easter.
COVID outbreaks. Healthcare workers tested positive. Don't change your radio dial, for we will be back after this short reminder.
DYZX Real Talk Radio 91.5 on your dial.
Time check. It's 2 o'clock in the afternoon of May 27, 2021.
You're tuned into
DYZX Real Talk Radio. 117 Colorado nursing homes receive fines from the federal government. Here's Devine Oclarit, live in Colorado.
Good afternoon. Yes, Camille. More than 100 Colorado nursing homes that experience COVID-19 outbreaks were fined for poor infection control, such as poor hand hygiene and other pandemic-related failures. One of them is Sierra Vista Healthcare in Loveland, where 18 residents died of COVID-19 during an outbreak that started in December. The Centers for Medicare and Medicaid, an agency within Health and Human Services, fined Sierra Vista almost $40 million in 2020. Also, at least 2,516 residents have died in healthcare facility like nursing homes and assisted living centers in Colorado, according to the Colorado Department of Public Health and Environment, data downloaded in March 2021. It is unbelievable, said Brian Lee, who runs Families for Better Care, a group that advocates for nursing home residents and their families.
Decontamination using hand hygiene remains one of the most important and effective methods for reducing healthcare-associated infections and cross-infection between patients. In 1860, Florence Nightingale wrote that nurses should wash their hands frequently throughout the day, demonstrating an early awareness of the effectiveness of this simple procedure. The COVID-19 pandemic has demonstrated that effectively applied hand hygiene is a vital intervention that can be used to prevent the spread of disease. According to the latest guidelines of the World Health Organization, healthcare workers should practice proper hand hygiene before touching the patient, after touching the patient, after touching inanimate objects in the patient's surroundings, after exposure to bodily fluids, and before clean or aseptic technique. According to Mark Dexter Hallier in his study using effective hand hygiene practice to prevent and control infection, the subject of hand washing is a deceptively complex issue, and compliance is affected by a range of factors including accurate knowledge, the correct decontamination technique, human factors, the environment, and effective leadership. The Hand Hygiene Liaison Group and Department of Health issued guidance stating that hand washing reflects attitudes, behavior, and beliefs. The influence of role models may be critical, and the liaison group calls for teaching of elementary hygiene practice at medical school. Another reason.
Good afternoon, Camille. The failure of healthcare professionals to comply with organizational hand hygiene guidelines is an important ethical issue. In applying ethical principles of non-maleficence, healthcare providers have a responsibility to protect patients from harm, which in the case of healthcare-associated infections can be avoided by the following proper hand hygiene procedures. In respect for professional autonomy, professional judgment is required when it comes to hand hygiene in majority of healthcare-related activities. It may be reasonable under some circumstances to not perform hand hygiene. Care must be taken to ensure that justifications continue to put the patient's safety first and that they do not creep into circumstances where hand hygiene is appropriate and necessary. In beneficence, a healthcare professional's responsibility is to focus on the patient's well-being. When a healthcare provider fails to practice adequate hand hygiene practices, he or she is endangering the patient's health by engaging in these behaviors. Paz Orang, reporting.
DYZX Real Talk Radio. Wearing of face masks in England, a must after Easter. Let's call in Miss Elaiza Parone for the report.
After the Easter holidays in England, secondary school pupils must keep wearing face masks in class, said Education Secretary Gavin Williamson. However, head of the school leaders union ASCL Jock Barton said that wearing of masks in class is not ideal as it disrupts students' education. But Patrick Roach, General Secretary of the NASUWT Teachers Union of England, expresses the need of following safety precautions, saying, "We are not out of the woods yet, and maintaining the highest levels of COVID-19 security in our schools is critical as we move into the new term in order to protect the safety and health of teachers and learners." Ethico-Moral with regards to wearing a face mask in England, a must after Easter. Students who refuse to wear face masks is an important ethical issue, especially if the school attended mandates them.
And now, for the ethical principles, we have Miss Kate Florence Palco.
In the light of the current COVID-19 outbreak, the World Health Organization mandated the use of masks as a strategy of measures against the virus for both healthcare workers and for public use. Evidences from RTCs where wearing a face mask resulted 80% to 70% efficacy rate for both compliant subjects and protecting the wearer as conducted in Australia and Beijing against SARS-CoV and influenza-like illnesses. Schools have to protect students from harm just as much as healthcare professionals do to their clients. And in this case, students are mandated to wear face masks given in classes. With the implementation of the said practice, it not only just prevents further spread of the virus, but also protects the students from it. Wearing face masks is an evidence-based practice that had helped in reducing the spreading of virus. Students who wear them benefits the public of helping in diminishing the number of positive cases and preventing the harm of others. It is reasonable for a student to fail to comply with the said practice with the reason that it disrupts his or her education. It also must be understood that the wearing of face masks is only to provide protection and that students are entitled of that protection. This is Florence Palco reporting.
DYCX Real Talk Radio.
Time check. It's 2:08 in the afternoon.
COVID outbreaks. Healthcare workers tested positive. Here's Camille Marapoc for the report.
The pandemic has been one of the alarming situations that the country is facing. Therefore, precautionary measurements like physical distancing was implemented. But at a public hospital, people waiting in line to have a checkup were close to one another, disregarding the 1-meter physical distancing that the government and the Department of Health implemented. One of the healthcare workers, which was a nurse, advised those people to observe physical distancing but seemed to forget it as she was approached by a patient's relative and hugged as a sign of greeting. This has been one of the alarming situations that the country is facing, as statistics shows that even in a healthcare facility, its workers could also test positive. This has been Camille Marapoc reporting. On the other hand, here's Isaac David Marcelo for the evidence-based practice and Ethico-Moral. Isaac?
Now, let's call in Mr. Isaac Marcelo for the evidence-based practices and ethical morals of social distancing.
According to the World Health Organization, healthcare workers should practice 1-meter physical distancing to places that are crowded and refrain from having close contact when greeting to other people. Instead of the traditional greetings, practice other ways of welcoming a person such as waving to protect oneself and to the close contact individual. Having close contact with a person in a public place is an ethical issue, especially when there are health protocols pertaining to social distancing. In non-maleficence, healthcare workers have the responsibility in protecting themselves and to the other people around against the spreading of COVID-19. However, the right of a person to greet another individual in their free will is his or her right. But with this pandemic, following physical distancing will help limit the spread of the virus. This is Isaac David Marcelo reporting.
That's all for today's news. Once again, I am Devine Oclarit,
And I'm Camille Marapoc.
proud members of KBP.
Copy sana ng mga broadcasters sa Pilipinas.
DYZX Real Talk Radio. Multitude of voices,
At single velocity.
delivering news at the speed of sound.
107.9 your radio dial.